All right, very good morning. We are glad that you created time to be with us in case you're just joining us now on Daybreak. And we are taking this conversation to another level as we talk about matters sexual and gender-based violence on this Wednesday of this particular week on health and lifestyle. And of course, I'm sitting in for Willis Raburu. My name is Safin Acheng Oma. And we just want to talk about this and to understand more when we talk about sexual and gender-based violence. What exactly do we mean? What progress have we made as a country when it comes to managing this? And in case you find yourself in a situation, what is it that you need to do as the next point of action for you to get help? Or if you become a witness to a gender-based violence incident, what is it that you can be able to do to be of help to somebody who really needs it at that particular time? And that is what we want to talk about. Of course, just coming after the conclusion of the 16 days of activism against gender-based violence. And we chose to take this conversation forward so that at least we can be able to help each other and make the society safe for us. And with me in studio to have this very important conversation, I'm having a panel of two ladies. And of course, just to introduce from my far right there, she's not new on the program, Dr. Elizabeth Warui. She's a medical doctor. Asante Daktari for creating time for us once again.
Thank you very much for having me here.
Right, and of course we have this morning as well, Catherine Chacha. Catherine is she's the National Director, Women in Global Health, the Kenyan chapter. Thank you, Catherine.
Thank you so much for having me here today.
All right, and of course we just want to talk about SGBV. Yeah. And I know what we've done here, many probably would be thinking that when we're talking about SGBV, it's all about women, it's a women affair, it's a women issue. Let's begin by just demystifying this. Is it essentially about women? Let me start with you, Daktari, when you discuss matters GBV, or it has a bearing also on the men?
Yeah. So, yeah, sexual and gender-based violence is not mainly about women. It involves both genders, both men and women. So, and we'll start by defining what is sexual and gender-based violence, rather what is gender-based violence. So it's any act that is perpetrated against a person's will and is based on gender norms and an unequal power relationships or an equal power. Basically, it's an aspect of gender and an aspect of unequal power relationships. So it affects both women and men, girls and boys, but the fight against it is mostly directed towards women because they're the ones who are, the most survivors are found to be women. But it affects all races, both genders, so it does not discriminate. Yes, so yeah, both genders can be affected.
It's not a respecter of persons.
It's not a respecter
or a
of
respecter.
persons.
Oh yeah. You may be today it may be somebody else. Tomorrow it could be you. So you never know. And it could be a woman. It could be a man. In fact, we are seeing a rising trend when it comes to. I don't know whether it was there before, just that they are becoming more vocal now, or it's something that has been there. Maybe you can add your voice as well on the misconception that has been there that gender-based violence is all about women. Has it always been there among the men, or are they just suddenly becoming vocal about it? What's your assessment of that?
Okay, I'll say we have brought up a culture where men silently don't speak up. And then being a nurse, and I have worked in health facilities at different levels, I'll say we have seen men who have undergone violence coming to the facilities but silently don't want it to be echoed out. So it's a culture that we've developed where men are really feeling that once I speak up against violence or I have been violated, nobody will listen. And the surprising bit is men are not able to embrace men who undergo violence. So it's a culture where when men want to speak up, there's a voice that tells them, you're a man, you're not supposed to speak up. So men are undergoing violence, but now this is the silent violence, which is so worrying and coming up. And we cannot say that men are not violated. They are violated, but they really are not able to speak up and tell people that I am undergoing violence. I am undergoing sexual violence. Because when you talk about or ask any man undergoing violence, the men are the first people to tell them, how can a man be beaten? How can a man be sexually violated but it's there, and we need to really speak up against it.
Yes, and to add on to that is how society has socialized the aspect of men speaking up. So men in our society are termed as leaders, they're termed as providers, they're supposed to be strong. So once a man comes up and tells a fellow man that they've been violated, that they've been beaten, once they come up crying, they'll be termed as what? Weak. Yeah, so how society has socialized the aspect of patriarchy, how we've been socialized, the mindset that we have is what is causing men to not speak up, and that's why it has been thought of mainly to be a women thing. So that's why we're trying to create awareness to tell men to also speak up, because even the numbers based on the KDHS survey shows that only 1 in 10 men are facing gender-based violence, and that's not the case. That's not on the ground. When you assess how the situation is, you find that there are more men who are actually facing this. It's only that they are not speaking up, they're not speaking out because of the societal norms, how we've been socialized to think. So yes, the cases of men are there, only that they do not speak up and they do not support each other. Yeah, so demystifying that as well is very important.
Yeah. You know, the most unfortunate bit about the statistics that we have is the fact that these are the only cases that have been reported.
Yeah.
And they are, I think, even more than double that have just been kept under the wraps, that people have not come out to speak about. So we really do not know whether we are dealing with a real problem when we use the numbers to inform our interventions or not. But we'll talk about the silence, because we are going to also address some of the challenges in addressing SGBV as we continue this conversation. But I said earlier when we were starting that we are having this conversation just at the climax of the 16 days of activism. And this was a time when it opened up a lot of conversations on how we have managed gender-based violence and what are the gaps, what are the steps we have taken, the gains so far. And I just want to get from both of you ladies, if you observe the trends in our country, what concerns you, what are the issues that you'd like, you know, that going forward we should prioritize in addressing this? I'll start with you, Dr. Arroy.
Okay, so I'll start by, first of all, commending the government that is in place and even the previous government, because there were 12 bold commitments that the previous government under His Excellency Uhuru Kenyatta came up with. Various bold commitments in the trying to increase this fight against gender-based violence. Some of them include like Polycare. Polycare is police care in full, and this means it's a one-stop shop where a gender-based violence survivor can go to a police station and get all the services they need. And so services of a survivor is usually multi-sectorial. So you don't just need one person, it needs a collaborative support and a collaborative effort. So the Polycare the Polycare intervention was brought about to help this survivor go to one place and be able to get all the services they need. This includes reporting to a police officer. In the same station, they'll be able to find a medical personnel, be it a doctor, a clinical officer, or a nurse, who will be able to do the examination. In the same place, they'll be able to find psychological services for the counseling, and also a lawyer. So there's the Polycare, and we'd like to commend Nairobi County is already implementing that. So there's something else about UHC, incorporating a module of gender-based violence in the UHC funding. So that is also something that there's progress on it as we're speaking right now. Things like having shelters in counties, we are trying to avoid where a survivor has been there's been a case of GBV maybe in Garissa or Mandera, but the survivor has to come all the way to Nairobi to seek services. So the fact that shelters are actually a bit more now, and in each governmental hospital you find that any survivor who walks into a government hospital, they're able to get the GVRC services there. So the fact that there are shelters and there are facilities and services available for these survivors is also something very commendable. Also, the laws and policies in place, as much as they've not been fully enforced, as much as they've not been fully implemented, there's much progress, and there are a few steps that we can see are being taken towards the end of the GBV. So yes, based on what the government has put in place, you can see a few steps, as much as we are yet to be there. So the 12 bold commitments was in a bid to end GBV by the year 2026. Yeah, so we still have steps, we still have, let me not say a long way to go, but we are trying. For what we can see right now, there's a bit of we can commend the government for what
it has done.
Yeah.
I like the optimism and how you've chosen to go the positive direction. So painting a picture sort of like it's not all doom and gloom.
It's not all doom and gloom.
Yeah, there's a lot that we are doing, that we have achieved. It's work in progress.
It's work in progress. We're not there.
We're doing something.
Yeah,
but I want to flip the coin a little bit and look at, you know, the unfortunate side, because we are not there yet.
We're not there yet.
And there are points of concern. If you just observe the trends, the numbers keep rising. In fact, if you watch, you know, our news lately, you would see as if we have normalized cases of gender-based violence. It's sort of like it's just another statistic. It's just another incident. And they keep rising by the day, and they get even more, I would say, critical. Nowadays. It's really something that should concern us. But I don't know from where you sit, Catherine, what is it that concerns you about the trends you're observing that you'd just like to point out that we should be sensitive to as society when it comes to matters GBV?
Okay, my key worry has always been, as a country, everybody thinks gender-based violence is away from us. When you look at the stories we see on the televisions, we hear on TV, we always think this case is for Mr. So-and-so or Mrs. So-and-so. But I ask ourselves, the government has put up policies. The government has done what they can do. What have you done as an individual? So I always go back and ask, when you see violence in your neighborhood, do you have a voice? Does anybody speak up against it?
No, they say, hiyo ni maneno yao.
Exactly.
You know, maneno ya watu wenye wanapendana, usiingilie.
Exactly.
You see, that's what...
Yeah.
But when there is a case of somebody has been murdered, we come up boldly now to say the story. And it saddens me when you hear a story of walikuwa wanapigana kila siku, they were doing this every day, wanagombana, but leo tulisikia tu a sound and it went silent. We didn't even confirm. It took us hours to go and realize somebody was dead in that house. Somebody had been defiled in that house. A child was screaming for help because of defilement, but nobody came out. So I usually twitch the coin. Let me ask ourselves now, as individuals in the society, what have we done to end this violence? Have we brought our voices out? Have we, or is it that crying the government, the government, the government, but not coming up and saying, I can also take a bold step and stop violence. I can also take a bold step and start the conversation of ending violence. It's sad when you see a case of a child who has been defiled, very young child, maybe with somebody very close to them. Nobody reports about it, but one day you hear stories of, I used to know, the child had reported to me once, the child had said she was fearing staying with so-and-so because there was an element of being in danger. But, you know, we didn't want to interfere with these issues. Then the child comes up with emotional trauma, psychological trauma, physical trauma, after something that would have been solved with just one thing, speak up. So do we speak up against violence? So we should just change our narrative of, can all of us be on the table on matters of solving gender-based violence, but not be spectators and taking photos and taking videos and posting, but doing nothing to have this conversation of how do we stop this on our level?
Make it your business.
Yes.
Make GBV your business. If you hear somebody or if you suspect somebody close to you is in danger, make that your business and take action. Maybe Dr. Arui, can add on that. And even as you do that, you tell us a bit about how society and culture has also contributed to the sustained cases of GBV. You know, how we are wired, how we are raised, how we are taught. How has it impacted how we view GBV?
Yeah, so that's a very good point. So as we mentioned earlier, society, how we've been normalized from growing up till now. As I mentioned, let me speak on the male aspect. As I mentioned earlier, there's a lot of patriarchy, what we call out there toxic masculinity. When a man speaks out, it becomes something, a man should not speak out. A man is termed as weak. So how society has conceptualized this aspect is where men cannot speak out. And then when we talk about culture, what culture has done is now things like FGM, things like early child marriages, these are things that are based on culture. So certain cultures, especially from the eastern part of Kenya, these are things that are norms. It's a normal thing for a child or an adolescent to be married off early, someone below 18 years. So it has been normalized. It's something that is culture-based, and this is what now we are speaking about, and we're creating awareness about. These are harmful practices that need to be stopped, that need to come to an end. So culture is based on, and also children, and a good aspect is children. Children growing up in schools, we find that when we're holding talks like sexual and reproductive health talks, we find that it's usually a topic of girls only. We find that when such topics are being discussed, boys are usually segregated away from the girls. They usually are maybe put away to be talked about, to be talked about separate. I mean, someone is talking to them separately, or they just go and play football out there when the girls are being told about menstrual hygiene, sexual and reproductive health. So I believe that such discussions and such talks need to be held when both the boy child and the girl child is there. Because when we make this an issue of girls only, we find that these boys later in life, when they're not taught about these things early on, they're the people who become perpetrators later on in life. So we need to start from the grassroots level. We need to make these boys aware from as early as when they're in primary school, when they're being taught, when the ladies are being taught about sexual and reproductive health information. They need to be made aware. They need to be in the same room as these girls, as these topics or as these discussions are being held. So yeah, society and culture has played a very huge part, and it takes each and every person. As my colleague has mentioned, it takes my effort, it takes her effort, it takes your effort, and everybody at large to end this fight. It's not a fight of women only, as people deem it as. It's a fight of each and every person. Everybody has a part to play in the end of GBV.
You know, at this point, somebody would be wondering why we are sitting here having this discussion. And I would just like to understand from you, Dr. Arui, again, the last time you checked in terms of the prevalence rates of SGBV in the country, especially in the Kenyan context, you know, what are we dealing with? What are we looking at?
What are the numbers? It's good to also have a global picture of how the numbers are. So globally, the statistics are 35% of women have a likelihood of facing physical or intimate partner violence in their lifetime. Globally, 35%. Then 38% of all murders on women are usually done by an intimate partner. And then you come down to FGM and childhood marriages. 200 million people worldwide are at a risk of going through this or have gone through it. And bringing it down further, one in every 3 women worldwide have a risk of facing physical or sexual violence. So that is the picture.
One in every 3.
One in
every that's very close.
That is very close. That is very close. So when now we look in Kenya, based on the KDHS survey, it shows that 41% of women also have a likelihood of physical or sexual intimate partner violence in Kenya today, and 1 in every 5 girls face female genital mutilation and cutting, and also child early marriages. So this means that we have a long way to go. We still have a long way to go. Yeah, so the numbers are high, and now it's also good to highlight that these are the reported cases. We need to also know that there's a lot of underreporting that goes around with these statistics. So the 41% and the other numbers I mentioned, these are only the cases that we know.
It could be higher.
It could be higher because there's a lot of, first of all, sexual and reproductive health is a topic that is termed as shameful. There's a lot of stigma that surrounds that topic. So now you can imagine when it's rape, when it's forced, you can imagine how shameful now it is. You know, people are afraid to speak up because there's this aspect of terming the victim as it was your fault. What were you wearing? Why were you wearing a short skirt?
Why were you walking alone?
Why were you walking alone at night? So
why were you looking at this person?
Why were you looking at them? Why were you, you know? So there's a lot of victimization, victim bias based towards the victims. And that's why there's a lot of underreporting. So until recently now, where there's a lot of awareness and there's a lot of activism going around and people being made aware that they can speak up and there are services available and they're free, that's when now we find that there are a bit more numbers, but there's still a lot of underreporting that goes around with these numbers.
Catherine, when you hear these numbers, for me, I'm really concerned. How should we treat them? How should they help us, you know, going forward in terms of how we address SGBV?
One key thing is, I usually say there's a positivity part of getting numbers because for a very long time, there was an issue of there's no data on GBV, there's no data on GBV. But if you can get data, this guides in one planning. You'll plan knowing if there are interventions to be put in place with different departments. As my colleague talked about multi-sectoral collaboration. So every sector will have the mind of how do we plan on our interventions on prevention and management of survivors of gender-based violence? If it's the police, they will know that we expect this. So how do we strengthen ourselves? How do we make sure that we have police officers who have an idea on how to deal with gender-based survivors cases? If it is the health department, they have an idea on we need clinical management of survivors of GBV. So we are preparing ourselves knowing their numbers and they're being reported. If you talk about the social services, you talk about the children department, you talk about the judiciary. So all the sectors come together knowing we have a case here and there are numbers to prove this. Yeah. Then it will also put the mind of Kenyans to know it is just not, when we talked about 1 in 3, and all of us were shocked. Yeah. Because 1 in 3 is just, it's not just a number. Yeah. This is a number of a person who has undergone violence, and maybe the repercussions will not be seen immediately, but they'll have long-term complications of something that could have been solved. So to me, numbers usually make me have a shiver, because I ask myself, these numbers, anybody can be counted among these numbers. So what are the interventions? What is the planning? In terms of budgeting, how do we budget for interventions? In terms of putting structures in place that can help and guide, prevention is usually better. So how do we prevent? And then we put also structures in place knowing most Kenyans do not know, if I undergo violence, what am I to do next? So most of them are left in limbo. That's why you get cases that have undergone violence. Children who have been violated at a very tender age may not even know they became pregnant because they did not go to any health facility. They'll just be in shock with a tummy that is coming up, then realizing I was defiled, I could not speak up, but now I'm pregnant. So the numbers will guide in planning, the numbers will guide in how do we put policies in place, how do we put preventive measures in place, and what are we going to do to end or even stop this violence. Yeah,
I like what you said, because when you say 1, you know, 1 is not just a number. Yeah. You know, this is a person, and you've seen the impact that, you know, GBV has had on people, even children who grow in families where they see, they witness this form of violence. When they grow up, it actually informs how they live, how they make decisions, even in their own families. Even that victim, haven't you seen cases where somebody has decided to just commit suicide and kill all the children because of the stress and the agony that the person is going through at that time? So when you say 1 is just too many, and something needs to be done, because the impact could be replicated to people around them in one way or the other. But, you know, Dr. Warui, when we talk about GBV, you'd be surprised to know that there are so many people who are victims and they don't even know they are. Yeah. So talk to us about the forms of SGBV. I mean, open it up a little bit for people to understand, because it's all about awareness. Right. Maybe somebody has just been a victim for years and they don't even know that something is wrong with what they're going through.
Yeah, thank you very much for that question. So there are different forms of gender-based violence. So we have physical violence. This includes battery, basically physical violence. Then we have sexual violence, which I'll talk about later. We have economic denial. That is denial of services, denial of resources, denial of opportunities. We have psychological and emotional abuse, where you're being abused and whatever words you're being told are affecting you mentally. And this leads to isolation, self-harm, depression, and even suicidal attempts and suicidal cases. Yeah, so we have now again the FGM, as we had mentioned earlier, and the child marriages. So now when we go down to sexual violence, which is what now is prevalent when you talk about GBV, sexual violence, we have cases like rape. There's rape and there's attempted rape, and both are offenses based on the Constitution in the Sexual Offence Act. Then we have defilement. When you talk of defilement, we're talking of a minor, that is someone below the age of 18. Defilement also, there's defilement and attempted defilement. Then we have indecent acts. We have things like child sex trafficking. We have child abuse, child sexual abuse. So there are different types of sexual violence, and that is, those are the different types of violences that are there. Yeah.
All right. So you know, there's this you know, surge also that we have seen of girls getting pregnant, and it has been a concern. People are wondering, when you talk about early pregnancy or childhood pregnancy, why can't we just call them defilement? Because this is a minor. I mean, why can't we just hit the nail on the head and call it, you know, by its name?
So I think now that comes to defining what defilement is. Yes. So defilement is sexual intercourse with a minor, where the perpetrator is above 18 years and the victim is below 18 years. Yeah, so defilement, yeah, there's an adult who is, the perpetrator is an adult and the victim is a child. So usually then again there's sexual intercourse between two adolescents. Maybe you can
call it the Romeo and Juliet.
Yeah. What do we call that based on the...
It is still, because they are minors, but now the question comes in, there's a lot between the Romeo and Juliet.
Yeah.
Let's talk about it, because there's usually some gray areas there,
Yeah,
especially when it's two minors involved.
Two minors.
But first of all, just finish clarifying on the early pregnancies and why we can't just call it defilement.
So defilement now will only come about if this victim got pregnant by an adult.
Okay.
So that is defilement. So now when we come to teen pregnancies that have been caused by a fellow teen, I'm not sure if the Constitution clearly states that as defilement. Yeah, because I don't think there's a clear...
So how do we deal with that? Maybe you can chip in, Catherine. I mean, this Romeo and Juliet affair. Yeah, they're both minors, but what has happened is actually really, I would say, against the law. They're still under 18. So how do we deal with this?
I think now the conversation now comes to us, because most cases of currently teen pregnancies are the Romeo and Juliet relationships.
Yeah.
So that is worrying. And then you'll get that the minors in different categories in primary schools, secondary schools, already having sex among themselves. And already, if this is reported, that comes in as defilement, because these are that is a minor. The cutoff point is the age. So I think we really need to have, because all the cases you've seen, there are cases that have been presented in court, and they ended up being left out because they were Romeo and Juliet relationship, and that ended, and most of them were sent back for counseling. Yeah. So maybe I come back and ask ourselves, as a community, have we started this conversation of sexual reproductive health issues with our young children, for them to understand when, okay, I'll make a very funny point of when I hear a case of a minor and a case somebody has gone to court and the case ended up maybe with imprisonment for life or anything, I rush back at home and tell the people close to me, especially the young boys, there's a case and you will see this person has been sentenced, so keep off the young children. Because below 17, the court will not want to listen of, you see, we had agreed, we had a reasoning or something like that. So for me, for the Romeo and Juliet relationship, some of them need a conversation of understanding. As Dr. Wairui had talked over, when we're having the school health programs, who do we include in the school health programs? Do we put girls telling them about, you know, having sex is bad, you need to wait, and the boy is playing football, yet this same boy is part of this sex circle. So do we put up a conversation to end this Romeo and Juliet relationship? It needs both parties to be on the table. So we need these two parties to be on the table. So before they reach the part of they have to go to court, because at the end of the day, the boy has also a right to say I was defiled by the girl. Because they are minors, it happens, and the girl has a right to say I was defiled by the boy. So I usually ask, do they defile each other? But
in most cases, the way it usually goes on the boy's family.
The boy's family.
Boy's family.
Yes.
It's the boy who gets victimized a lot. I don't know why, whether it's fair.
The law also should be catered of, the law should be clear right now on bringing it up. How do we manage the Romeo and Juliet relationship? Because it hits back on the boys, because at the age of 12, apparently it said that the boy has the capacity to know this is an erection and this is what I can do. But for the girls, give them a leeway. But at times when you look at these cases, I'll give an example of once seen a case of a boy who was around 16, a girl who was around 16, impregnated by a boy who was around 15 years. So that the boy was younger. That is one thing. And the boy will say clearly that this was my first time and she told me this happened. So maybe a lot of conversation should go in. But let us remember, there are boys who do defilement even at that younger age. So there should be clearly understanding of how did it happen, and is it truly that they had a Romeo and Juliet relationship, or there was a defilement case
that happened.
Yeah, because we can keep on like it's Romeo and Juliet, but looking further, truly speaking, there was a defilement case that happened. So it should be not taken lightly. Further investigations or counseling or listening to both parties of the story before a conclusion is made that it's Romeo and Juliet.
All right.
Yeah.
I want us to go and talk about what do you do in case you just find yourself in an incident. What are the next steps of action? But just something that came out of what we were talking about, Dr. Arui.
Yes, please.
How do you begin that conversation with your son or daughter? We come from African families. I mean, these are not very easy conversations to put at the dinner table.
Yeah. So I think that's why now there's need for awareness. The awareness that we are creating right now is from that child who is in primary school, going all the way to people in the leadership positions and to parents, to colleagues, to people we're relating with each and every single day. So this awareness is to tell people that these are conversations that are not shameful. There should be no stigma around talking. It should not be stigmatized. Sexual and reproductive health conversations should be normalized. So I think it's an aspect of creating awareness because yes, in African homes, it's very difficult. And even I'm sure the three of us can bear witness that those are not conversations we were taught by our mothers growing up. Yeah, so I feel like just creating awareness and letting people know that it's not a shameful thing. There should not be any stigma surrounding sexual and reproductive health. And it takes both a boy and a girl. A girl does not get pregnant alone. Yeah. So that's why we need the boys in that conversation, in those discussions.
All right.
Yes.
So you want to add something?
Yeah. I wanted to say that one thing we should understand is as our children grow up, there are different body changes. Do you start the conversation of telling them that when you grow hips as a girl, that is normal? Or do we expect somebody else to tell them, you look beautiful because you've grown hips? Already the mentality our children get is, so this is a positive impact on me. But if we start the conversation on telling them, during puberty, this is normal. They grow up knowing, yeah, I expect to grow hips. I expect to have broken my voice as a boy. I expect this to happen, my broadened shoulders. And like somebody else telling you outside, wow, your shoulders look nice. So that one brings a different mentality and like being told. So we should start this conversation of normalizing this is normal from a very young age.
All right. All right.
Before we go to the management process, I've also just remembered something that is very close home. My young brother one day found a pad in my bag. Yeah. He took it and he went and asked my mom, what is this? And what is it used for? So that is now why we are saying there's need for men, there's need for boys to be included in these conversations. Because at his age, he's 12 or 13, he does not know what a pad is. And we know menstruation in girls start from the age of 9. So this is someone who needs to be doing that. This is a pad, and what's the use of a pad? So the need for conversation
that's
to be
a good
started.
one. It reminds me of a forum I attended, and they were trying to break down how this can be done. And actually, somebody can just take advantage of such incidences to start that conversation. You see something on TV, you see their reaction, and then you ask them what they know about what they've just seen. And that now opens up, and you start asking them questions about what they know and to tell them the right thing, what they need to know about it. And you sustain that conversation over time. All right, so let's talk about the management. And any of you can jump onto this. Now, so what are the next or the very first steps that a survivor of GBV needs to take? There's usually a lot of misinformation around that area. What is it that should be done?
Okay, I personally usually call them, we need to observe the 72 golden hours. Because a survivor, especially of sexual violence, there is need to rush. Okay, if you can go to the health facility early, that's a very good plus on you. One, because these are survivors who you might have been defiled or raped, and you get a pregnancy that you didn't even choose, of people maybe you don't know, you've never even met, or somebody very, very close that will traumatize you in the future. So the 72 golden hours gives you an opportunity to go to the facility and receive care that will prevent trauma or some things that can happen and you wouldn't pick. One, within those 72 hours, you should go and get emergency contraceptive pills because one, they will help you prevent from getting pregnant. Within these 72 hours, you can go to the health facility and you're given post-exposure prophylaxis. These are drugs that will help you prevent, if the perpetrator was HIV positive, it will prevent you from getting the virus itself. And then this is the time also you get drugs for STI, sexual transmitted infection prophylaxis, to prevent you from not getting STIs. But there are key pointers here. The facility will also help you get forensic evidence that will be used in court. So this is where we echo. When a survivor of sexual violence, you undergo violence in the community, kindly, one key step is, if you're able don't bathe or don't change the clothing that you are in. Because this will be very, very key for the providers to pick the little evidence that they can be gotten. And this will help in the due court process for survivor to get justice. And then the second thing is just get courage, because it's so hard, I know, to speak up. You need to just brace yourself and pick it up like, one, I have undergone violence. What should I do? I should not bathe. I should not change my clothing. But if it's so soiled, I know sometimes walking with it, it's so traumatic. If you can remove it, you put it safe in a khaki envelope. Or if you cannot get anything that is khaki, you can use newspaper, because we are avoiding something that is the paper bag things because of losing the DNA, the evidence bit. So you can put it and save it close for you to go to the health facility with or present it. And then on matters of where do you seek help, that's a question that you always get immediately. I know we usually echo the health facility is very, very key, because one, you'll get the immediate first aid that you need, and all the evidence needed will be collected. But if you feel that there's somebody who is close to you, you can visit that person. But echoing any survivor of sexual violence coming to visit, kindly refer them for healthcare, because we miss the 72 golden hours. We miss the key services that these survivors will get. These are survivors who come in pregnant after some months, and this is one strong drug would have prevented this. These are survivors who come in
with no evidence, with nothing. So
nothing.
It's an injustice that just goes like that.
Very
It's my word against yours.
And then HIV positive. You turn to be HIV positive, they live in stigma, and there's a wonder drug that could have prevented a survivor of sexual violence from becoming HIV positive. So, and then you'll get that some of them come with traumatic events. That's why we talked about suicidal attempts and even some of them committing suicide, because the key services that they receive also, part of it is mental health. You need to have a conversation. Most of them are in denial. I really sit down and ask myself, and maybe the three of us seated here, who would want to speak about consented sex? You'll openly go on live TV and say, I had sex last night and it was so good. Which was consented? Nobody would want. It's this unspoken thing that nobody wants to speak about. But now this is a survivor of sexual violence who their rights were violated. This was forced. They're living in trauma. So they need a lot of counseling too. So those are the key things that they need to do. Health facility, don't change your clothing. If possible, don't shower, because we need that evidence.
That evidence. Maybe you can add on to this. So the first thing I get, go straight to the hospital, or you can go to somebody close to you who can help you process the emotional trauma that you're going through. But that person also needs to help you go to the nearest hospital as soon as possible, even as you try to manage whatever has happened. But tell us more about, apart from the health, services, what else, and how do we get that what else in this process?
So just, sorry to take you back, in addition to what you mentioned, I'd like to urge hospitals, especially the government facilities, when we have a survivor of gender-based violence who's presented themselves to the facility, I think it's very key to not let this survivor wait in lines, because sometimes I've had cases where the survivor is made to wait in queues of other patients who are also being seen, and you can imagine the traumatic event that is sexual violence, then being made to wait in a line with other people. So it worsens the trauma. So urging that the hospitals, the government hospitals that have such facilities, to at least allow triaging or at least expediting the process of this survivor to be seen in a separate area, preferably. So further care that can be done is, so in a medical perspective, as she mentioned, I'll just highlight, you take the samples, which are very important for forensic purposes. We usually draw samples from anal, vaginal, and oral, and they're very important for forensic purposes and DNA to know who the perpetrator was. After medical examinations, we do the psychological assessment and counseling, as she said. Then there's the aspect of legal, because again, you'd want to follow up this case to court and seek justice, because at the end of the day, if your rights have been violated, you're seeking justice. And something I'd like to urge, maybe even the government, is also avoiding sorting these cases in kangaroo courts, where maybe you take such a case to the court and you're told to sort it as a domestic issue, especially if the perpetrator is someone known to you. We have heard of cases where the survivor has been the perpetrator is someone known to you as your father, your uncle, your brother, and you're silenced because you can't speak against this person, because maybe this person is a breadwinner, this person is someone respectable in society, so you can't bring up that you can't speak against them. So the point is, sorry, what was your question?
Yeah, I mean, apart from health.
Yeah, apart from health, yes, the legal aspect. We need to take it to court for them to seek justice, regardless of who the perpetrator was. So basically, the services that are involved is medical, psychological, legal, and the counseling goes on. It's not just a one-time or a one-day thing. It's something that goes on for a number of sessions. We usually have at least 5 sessions, and even after those 5 sessions are over, there's still continued support and care. And even at the community level, what we usually do is there are usually we form groups, peer groups, especially of people who've gone through that gender-based violence. So you introduce them in survivor groups where they can talk about it, they can talk about their trauma, how they went through it, the remedies that were taken, and also teaching the community health volunteers on how to early detection and early referral of such cases when they notice them in the community level.
All right.
Yeah.
And then to add on what she said, because in the healthcare, the level 1 of care is very important.
Yeah.
Which, primary healthcare is very, very key and cannot be forgotten. Mm-hmm. And then at the primary healthcare level, you have community health volunteers who do house-to-house visits. This is an attempt to take advantage on putting up a conversation on gender-based violence among the community health volunteers, so that when they visit these households, they're able to pick up the conversation. They're also able to detect cases of the unspoken cases who cannot report, and even do early referrals for early management. So it's an all-round thing. Who is to be involved? Everyone is to be involved in ending gender.
Everyone has a role to play. There's an officer watching us, Fred. Fred is a GBV director at the office of the Bungoma Woman Representative. Thank you, Fred, for creating time for us this morning. He says, a great conversation around matters SGBV. Thank you very much for empowering the masses on this crucial topic. And thank you also for the good work you're doing in Bungoma County. And I just want us to, because we're almost running out of time, to talk about the safe spaces that we have and the numbers that somebody can call in case they've just, maybe you can take us through the numbers, that maybe the general ones that somebody can call in case they need help or they need further guidance on how to go about this. Yeah,
so we have hotlines that you can call. So if it's the survivor is a child, that's someone below 18 years, you can call the 116 hotline. So that's specifically for child survivors. And then you have the National GBV hotline, which is 1195. So this is now for general survivors. Anyone who's undergone any form of gender-based violence, as we described earlier. Do not think that it's emotional violence so you can't speak out. Do not think it's economical violence so you can't speak out. Any form that you've undergone, you can call that number, 1195. Then we have the 1517, which is UNHCR toll-free number. So any of these numbers, when you call them, they're usually available, and there's usually someone on the other side to help you and seek whatever services you need.
All right. Yeah. All right. I hope you got the numbers. Plus, you can also get a link of this show on our YouTube platform, Citizen TV, so that you can be able also just to follow in case you missed it. And we're just about to wind up. Maybe let's talk about the safe spaces. Okay, so there is, reports that some of the perpetrators could be close family members or people known to you. So you've just been you're just a survivor of a GBV incident that has been meted against you by a person close to you, and you're going back to this environment. This person has influence, or they live with you in the house. So what do you do when you're caught up in that kind of a situation?
Okay, safe spaces are very, very key, because I'll give an example of what you've exactly said. A child who's being violated from the homestead, maybe the parent. How do you go to a home where your father is the perpetrator and you're still going there to receive violence? So there's need to the government to plan to put up safe spaces, at least in all 47 counties, because it's easy. It's a place where you get instant help. And then my question will be, what will be the component of a safe space? This is a place where you should receive all the necessary services. Psychosocial counseling should be available. Clinical management should be available. Something that will make you, even if I'm in a safe space, it's not a bed and breakfast thing. It's a place where after you come out, even if it's temporary, you come up knowing you're stronger enough, not only to speak up, but accept what happened and you can move on. And then this is a temporary measure of if the cases is in legal process, it is not tampered with. Because I'm thinking of a survivor who is a child in a home where the perpetrator is maybe the parent or an uncle, taking them there and they are to go to court. And this is the same person you're living in the same house and you're taking them to court. Will it be easy on somebody who is doing like that? It's not. Or a woman who is undergoing violence and the spouse, or a man, the spouse is the perpetrator and you're taking them there and you expect them to stand in court and speak. You're from the same house, tumetoka asubuhi, then we are going to court and I'm talking about you.
Yeah. It can't work.
It can't work.
And some of the let me call them survivors, because that's actually a fight.
Yeah.
You know, they need skills and know-how to be able to, some of them depend on people who may have perpetrated.
Courage. Yes.
So they need to be empowered to be even financially independent post this care, so that they can be on their own and they can be able to take care of themselves, so that they don't depend on if it was an issue of economic violence. We've run out of time for this conversation, but going forward, how do we push this agenda? How do we achieve more than we have as a country? And how do we sustain the gains that we have achieved? 30 seconds each. Let me start with you, Dr. Warui.
I think I'll start first by highlighting the aspect of solidarity. We need to act in solidarity. As we mentioned, each and every person has a part to play. I have a part to play, you have a part to play, we all have a part to play. So acting in solidarity, and also the frontliners, if we are able to support them, if we are able to especially online, you find that frontliners usually face a lot of backlash, a lot of online harassment. If you're able to support these frontliners, because they're the ones who are helping end this fight against GBV, so any support, even a kind word, goes a long way. So I believe working together in unison, in solidarity, and supporting each other will help us.
Thank you so much. Catherine?
I'll end up by saying, let us speak up. Each one has a responsibility of ending violence, and ending violence starts with me and you. So let us bring up the element of speaking up against violence and being strong in it.
All right, it starts with me and you, you who's watching. And thank you so much for creating time for Daybreak this morning. That's Catherine Chacha. She's the National Director, Women in Global Health, the Kenyan chapter. I was also having a sit down with Dr. Elizabeth Warui on this conversation as we were talking about sexual and gender-based violence. I believe now you know a thing or two, and now you know what to do in case you yourself find yourself in a situation or you witness an incident of sexual and gender-based violence. My name is Safin Achieng Oma, or standing in for Willis Raburu. Thank you for creating time for us once again. Enjoy the rest of your viewing.